Good morning, everybody. Thanks for joining us. We're going to have a very important conversation. Dr. Maureen is in the room. Good morning.
Good morning, Nan. How are you?
I'm great. I'm happy to see you. John is here. He'll be
Hey,
joining us. I
John.
don't have my headphones because I want him to be able to hear. Hi, Dr. Teresa Wood. Wonderful to see Teresa here. I hope Teresa's going to not ASECT, Ishwish. We're going to go to Ishwish.
Ishwish. Yep.
So while we're waiting, Scott's unable to join. Let me resend him his invite. Sometimes this is a little tricky let's try again. All right. And let's re-invite Lemore. For some reason, it takes a little bit of finagling to get people on, which is always a little nerve-wracking in the beginning, but we get there.
Yeah.
So tell me what's going on. We're going to talk about ADHD in relationships today.
Yeah. Um,
Yeah.
I'm excited about this topic because as a practicing physician who sees mostly adults, this comes up quite a bit. And it's a whole different ballgame when you have an adult versus when you have a kid. And it's actually different if you have a woman and a man. So I'm like super excited to talk about this. Most of what I've learned about ADHD, I learned from my pediatrician husband. So
So there you go. I wish that there was better information out for people on kind of how to figure out if this is happening to one or more partners, if this is something that is an issue. Okay, Scott, we're going to try it one more time. Let's see. John, would you call Scott?
Sure.
Okay.
everybody seems to get on eventually, but
I
it
know.
takes forever.
Sometimes three times is the chart, I don't think I gave him the phone number for. So Scott hopefully is going to be able to join us. And Lemore too. So one of the things we're going to talk about are what are the we got Scott in the room. We're waiting for him. It says he joined. This is always so much fun. Just getting everybody on in the morning when we get started. So I'm here. So do you have your camera on, Scott? Let's see. You should be able to join as a guest. We've got technical problems. I think this is, one of probably the first time Scott's joining. Can you, let's see, you're here. He's texting me. Let's call him.
He's in
So
the
you have to,
chat at
Maureen,
least. Yeah.
yeah, when you accept the invitation, you automatically is unable to join. Let's try it one more
It
time.
takes a few seconds to link, but there's like you either send a request or you send me a request and I just
Yeah.
tap the button.
So I've invited him to join again. So we have his phone number. Please, folks, thank you for your patience. We've talked about sometimes how hard it is to have patience. And when people have challenges, he doesn't see the invite. Let's try it one more time. Invite. Okay. Now, Maureen, when you get the invite, where does it show up?
Down at the bottom of my phone screen.
Yeah. So let's get him on the phone. John, fortunately, we have our husband here, my husband, and I'm going to ask him while we're waiting to get Scott on the phone. So Maureen, will you talk about your experiences when it comes to ADHD and how you see this impact people in your practice?
Yeah, absolutely. So knowing that a lot of people were not diagnosed as children, especially in my age cohort and above, there are several patients that come in pretty regularly who think they have ADD or ADHD, and they have lists of symptoms like I cannot stay focused. I start one thing, then I go to the next thing, then I don't finish anything and I get distracted and I just feel like I'm constantly having a million thoughts in my head. So it's hard, I think, and hopefully we can get Scott on here because there's a diagnostic criteria set in a test for children called the Vanderbilt, which they take and then school officials or teachers and other people will kind of fill out their assessment of the kid, and it gives a lot of background information into like their activity and their behavior patterns and stuff. And I feel like it's much easier to get at least children who have the hyperactivity component for sure. But I feel like for women, there are more just attention deficit and not necessarily hyperactivity. But when that starts showing up in your adult life, there is virtually no one to help you. And a lot of people end up seeing me as a gynecologist and asking me like, I don't know what to do. How do I get help for this?
Good
Hey, there's our
morning.
expert.
How,
Good
how are
Scott,
morning.
you?
it's so
I'm great.
wonderful to see
It's
you.
great to see you
Yeah.
too. Thank you so much. Thanks for having me on here.
One of the issues with Instagram live stream is that it's a little bit tricky sometimes to get on the call.
Mm-hmm.
Sometimes it's three times is the charm. I still don't see where Lemore is. I'm going to invite her one more time. While I'm doing that, Scott, would you like to introduce yourself?
Absolutely, absolutely. Thanks so much. So my name is Scott Shapiro. I'm a board certified psychiatrist in New York and also see people from New Jersey, and trained at Harvard Medical School's Mass General Hospital. And I've been specializing in helping people with adult ADHD for now over 20 years.
Awesome.
So we have lots of questions for you too.
Okay,
Yeah, and so
let's get into it.
this whole sort of conversation that we started with, I don't know what happened to Lemore. Perimenopause and unmasking ADHD is a thing. We're getting comments from people watching,
Wow,
doctors
that's
and
a
other
really
things.
great question.
Yeah.
Yeah, so we started this so that we could talk about whatever we wanted to talk about. I think our momentum about this was coming around the election and how we were all stressed out and we were thinking about how this is going to impact people, our clients, our patients, our partners and everything. And so we're opening up the conversation about, for me, it's all about how you can find your way to pleasure as a person and as a partner. So, how do you think, in your experience, Scott, does ADHD impact relationships?
It's it's a great topic. I'm so glad that we're talking about this today. And one thing is we're going to talk a lot about some of the challenges that ADHD creates for an individual, for an adult in their own life, and also in a relationship. But I think while we're talking about this, we have to also realize this is just one part of a person. And there are so many relationships that I've seen over the past 20 years with where one partner or both partners have ADHD, whether it's been diagnosed or undiagnosed, treated or untreated, where the relationships have had struggles and have required work. And yet, as both of you know, relationships require work.
Yeah.
And I've just seen people really learn a lot of strategies, get the help they need, and relationships really strive and improve and grow.
So, what do you think is the most important thing when people are trying to grapple with this for them to know, just as an overarching kind of key takeaway when you or your partner, both of you, have ADHD and you're in a relationship?
Sure. Well, it really depends on whether a lot of people I see have suspected it for years and have never been diagnosed. So it really depends on whether the person has been diagnosed and appropriately treated, or whether they haven't been diagnosed. And so really the first step is making sure that the person has a diagnosis or is getting treatment if they've been diagnosed before. And that really isn't necessarily medications or just medications, but really involves addressing the full picture, which often includes addressing using cognitive therapy.
Hi
Hello.
everyone.
Hey,
I am so sorry to
welcome.
interrupt you. Please go
Yeah.
ahead.
So it's really addressing the full picture, not just saying here's a medication, but really addressing comprehensively using cognitive therapy, schema therapy, or other tools to help the individual with their own lives, but also with the relationship. And so some of the key problems or challenges that people have within a relationship, I would say there are really three challenges that I see. One is communication. Two is attention and focus, which is core to ADHD. And three is really time management. And really, when there's an awareness upon both partners that this can impact the relationship and how we can address it in an effective way collaboratively, that's when I've seen people have had the best outcome.
So if you're aware of the issue and how it impacts the individuals, then you can work with it. So I
Absolutely.
think, as a couples therapist, that's like what 90% of what I'm doing these days is couples counseling, because sex therapy is part of it, but a lot of people I'm seeing for just couples issues. Really understanding, I think the first step with couples is understanding their differences. And rather than thinking the partner is wrong or there's something wrong with them, understanding there's perfectly valid ways of being that are different than you are. And if you understand, for example, that your partner has or you have some particular issues that are challenges, then you can work with it, especially if you have really good communication. The other thing I find is a big, big issue for most couples is being able to regulate their emotions around the issues that they're having. If they're not regulating their emotions and being able to be calm and non-judgmental enough to listen, they're not going to be able to bridge the differences, whether it's just kind of differences in the way they're wired, or whether there are differences in terms of how, they have one partner has a diagnosis or suspects they have ADHD. So it's really when you can talk about anything, which is why we want to talk about everything here.
Right.
It makes it a lot easier to be able to work with a partner.
And you know what? I think communication is so important. And whether in the relationship there is ADHD or not, I think you're still going to work with communication, but there are certain challenges. So when one of the partners has ADHD, whether this is a long-term marriage or dating or living together for a couple of years, the communication is so important. And some of the challenge can be distractibility, impatience and interrupting, not listening, and forgetfulness. And so with a lot of the people, whether I'm working with someone individually or in a couple, we really start working on how do we improve the communication. Because I know what's often talked about, and this I'm sure we'll talk about later in the show, is really intimacy and sex. But if you don't start with the communication at the beginning, outside of the bedroom, then it's going to lead to problems in the relationship and obviously with intimacy, connection, and sex later on. And so, as Nan and all of you, I'm sure that you often encourage your patients to learn about active listening. But one tool that I've found really helpful, well, again, even if I'm working with just one of the partners, is something called an intentional dialogue. And this comes from imago therapy. And it really is getting rid of all of the distractions, setting aside a clear, intentional time, and starting to talk with each other where one person's the listener and one person is the sender. And it's a very structured conversation. And structure, I would say, is the number one thing that I've seen that's helped the patients that I work with.
Interesting.
I can't agree with you more. And one of the things I'm working with people, pretty much everybody who comes into my practice who's having relational challenges, is how they can learn to calm their own nervous systems enough
Yeah.
to be able to stay present and non-reactive, and to really get the understandable part of what's going on with their partner, so that they don't run and just kind of judge and then go into automatic, defensive patterns.
So you're
So that's a
teaching,
biggie.
so you're teaching the couples that you work with, whether one has ADHD or not, how to regulate their
I'm
emotions.
teaching everybody because
You're
I'll tell
teaching
you,
everybody.
Yeah.
everybody, because, one of the reasons why people have so much trouble in relationship is that in relationship, we're so affective of each other and we can get so triggered. And because we're different, whether it's neurotypical versus not neurotypical, or whether it's just how we're wired in the basement of the brain, as I talk about in the book, how we maintain our emotional stability. There's so many different variables that we differ on. And when people are not able to recognize that the way their partner is not only okay, that they can accept these differences and get curious, which is the seeking system, to feel calm and connected, that's the care system, to get a little playful, which is hard for people when they get.
Absolutely.
So we need to interrupt the reactivity. And I wanted to just take a moment to introduce my husband who's here with us. So I want
Oh,
to
wow.
come
Our
join
Hello,
in the
co-dad.
Scott.
screen. Come join in
Hi,
the screen.
John.
Hi, everybody.
Hey,
Hello.
John.
John,
So
can
nice
you introduce
to
yourself a
meet you.
bit?
Hi, everybody. Well, Scott, I'm an ADHD diagnosed adult. Um,
I had no idea.
yeah, it was 58 years old or so, and I went for a psych eval. And shout out to Mike Cunningham, a great psychiatrist, who really took me in hand and helped me get a good diagnosis and a good pharmacology program, and continued with therapy. And here I am, happier and healthier as a result.
Wow. Wow. Well, thanks
And
for
it's,
sharing that. I mean, I think that sharing that really helps people that are out in the audience, seeing someone who sought help regardless of what age they were
Yeah,
at and getting the help and treatment and seeing that it really made a difference.
and
yeah,
when
yeah,
people are so high functioning that they're able to get by in spite of their challenges, but they're struggling all the time, it takes its toll on them. It takes the toll on the relationship. And once we, realized what was going on, it made it a whole lot easier for us to understand sort of where we used to struggle together. And fortunately, John has always been interested in psychology, so we did a lot of couples trainings together. We've done active listening together for like 30 years, if not longer. But we need the tools. And unfortunately, I think if people don't know that there are tools to help them organize themselves and time management, if they have symptoms of ADHD, that there are couples tools for all couples, and especially if you have challenges, it's only going to make it harder. So,
You know what's so interesting about what you're saying that you focus, in your book as well as with your people that you see for couples therapy is about calming yourself down, calming the nervous system down. And it's very interesting because this is already on the fifth edition of the DSM where people diagnose what are the symptoms of ADHD. But there are, I would say, especially for adults, a significant number of symptoms of of adult ADHD that are not in the DSM, that by research we know. And one of the challenges I would say that is present the majority, if not all of the time, with people that I've worked with is challenges with emotional regulation. So I think that that's fantastic that you work on that, and especially because the medications help with the core symptoms, but they don't help with things like emotional regulation. The ADHD
right.
medications don't help with emotional regulation or executive function or time management. These are things that the strategies, the therapy, working together on it are so essential. The medications help, but it's not the full story.
and from my understanding is that being stressed out will worsen the symptoms of ADHD as well as other issues like my generalized anxiety disorder. Whatever we got, it doesn't get better with stress.
That's right.
So when you're stressed, when your nervous systems are activated and then your co-regulation is dialing up and then you are pouncing like women Sometimes women in partnerships, men need a slow start to conflict because their nervous systems react faster. So what we know from relationship science is that women who take a slow start up to conflict and men who take influence from their wives do much better. So I had to really work on myself so that I wasn't pouncing on him. Because when you pounce on somebody, ADHD or no ADHD, it doesn't usually work out so well.
That's right. That's right.
That's so beautiful of you to share, because I feel like also last week we discussed with Susan Bratton about how they together as a couple then went on this journey of healing her trauma and coming out of it. And yeah, this is another example of how you can really be in a partnership and help each other. It's not just like a your problem or my problem, but let's work on it together and let's co-regulate.
Scott, as a practicing gynecologist, like I see regular gynecology patients in addition to my menopause and sexual counseling practice. So I see kind of all sides of the problem. I do see it in counseling, but more often I see the undiagnosed adults or the likely undiagnosed adults. And most of these people have already seen their primary care physician, feeling like they're all dysregulated, feeling like that's the only answer for how they've been behaving for maybe decades, especially women, because again, I feel like there's less of a hyperactivity and more of a ability to kind of like function highly, but yet feel chaotic inside and easily, change focus. So I've actually struggled because by the time the women come to me, they're like, no one will listen to me. My internist just brushes me off. And so I find myself doing a lot of internal medicine these days and kind of basic primary care. But like, what do you say? How do you, I mean, as a specialist who it's hard to get people to psychiatrists a lot of the time, what are those of us peons doing like basic care trying to help people do? Because like I've been putting people on medication with the guidance of my pediatrician husband, but I'm like one small person who actually will go there because I see it and I know how much it improves their life and their functioning just to have the diagnosis and the treatment. So I feel like there's a big issue out there with undiagnosed adults.
Mhm. It really is. From the research, and I can't cite the source, but this is from an article that I wrote a while back. 10% of adults are actually diagnosed and treated. So you're exactly right. There's a large number of people that are out there that are not diagnosed and treated. And, one issue I would say, it's hard for someone who suspects it or has been struggling with it, or maybe they were diagnosed as a child. One issue is really for those of us in the mental health field to become more educated about it. That for psychiatrists and therapists and psychologists to really learn in training that adult ADHD is real, how to
Wow.
how to diagnose it, and how to treat it. Because even in my training, we would often learn treat the depression, treat the anxiety, treat the insomnia. And if anything's left over, maybe there could be ADHD going on. And when I teach residents, other clinicians, other doctors, I say that very often that if you diagnose and treat accurately and appropriately the ADHD, very often the anxiety, the depression, or what may look like a personality disorder could actually get a lot better.
Yeah.
I mean, I've seen people that have come to me that have, and a lot of times the rule is that with ADHD, there's other diagnoses. Very often there is depression, or there could be anxiety, or very commonly sleep disorders. So you do have to be careful because the symptoms overlap, but other diagnoses come along with it. But very often, after I've seen and done a thorough evaluation of the person, very often I will collaboratively with the patient treat the ADHD first and not go straight to the anxiety or straight to the depression. Some certain circumstances you can't do that. If there's a high suspicion of bipolar disorder, you got to treat that first.
Yeah. Yeah, well, I'd like to also just point out that, like, even psychiatrists, right? Like, there are things within your specialty that you guys don't learn enough about, which is kind of like my side soapbox, because I feel like none of us learn enough about sex in medical school or residency or training or afterwards. And we can do
You're
things
so right.
we do things that harm people potentially when we don't actually admit that we don't know something, or we don't know enough to help people, or we don't know enough to refer out. So I'm glad I'm sad that it's even ADHD within psychiatry, but I feel like there's a lot of stuff. We get good training, but like there's just not enough time to learn about everything. So I'm amazed that the psychiatrists don't even know a lot about this in
Many
some
do,
ways.
and many more now. But in terms of my training 25 years ago, um,
yeah,
it was not a top priority.
we're probably about the same
What
age.
do you wish the psychiatrist knew from your specialty?
Oh God, mean,
There's so much. You're right.
So much. There's a lot. I have a bigger list, I think, for internists.
Okay.
But no, the list is huge. A lot of people just chalk stuff up to hormones for women. Oh, you're hormonal. Oh, it must be this. Or they write off the symptoms at menopause as like, oh, they're just whiny. Like, there is a list of like 60 different symptoms that women have that are due to lack of estrogen in their bodies. And so, I don't know. I think there's a lot we can all learn. I wish I learned more about how to deal with people like all you guys do, because I feel like most of us who are not in psychiatry and who are not mental health providers, we don't get enough of dealing with just the day in, day out depression, anxiety, and relating to people who are like their basement brain is in fight or flight all the time. Like, I trained about 25 years ago too, and some people with anxiety exhaust me, and I was never trained to deal with it.
Right.
So enough about me. I want you to tell us a little more about when you get these adults and they are you're treated and things start to improve. Their relationships must improve too, even if they still have work to do, I'm guessing.
So, you mean as they get treated, the relationship can get better?
Yeah.
Well, there's still work to be done.
Yeah.
So their ADHD may be diagnosed now, and they may or may, and not everyone that I diagnose with ADHD necessarily needs to be on medication or chooses to be on medication. It's a collaborative decision. Sometimes the treatment may be cognitive therapy, and in some cases it may be the cognitive therapy plus, medication. But you're right, it's not just the diagnosis or the treatment, because like I was saying, the I would say the core symptoms that get in the way of a relationship, as well as people's career and family lives, are not those core symptoms of the focus and distractibility and hyperactivity, but really the executive function, the emotional dysregulation, the time blindness. That those things are not going to respond to medications, and so the diagnosis and starting the treatment is really just the tip of the iceberg. And so what I see starts improving relationships is, and I see a lot of people individually, and so I'm helping them with time management, with how are they going to remember when their spouse or partner asks them to do something, or there's a special occasion coming up. And just being in a relationship with ADHD can be challenging, but then add on top of that children, and then there's a lot of executive function that needs to happen. And so I see relationships, even when I'm just working with an individual and they've decided to not be in couples therapy, as the partner improves with time management, organization, taking on responsibilities, listening better, learning how to do active listening or an intentional dialogue, learning how to plan in advance and be proactive and be a team. You wouldn't believe how often I've heard from the individual with ADHD, or maybe the spouse who calls me. If they do have children, they'll sometimes say, not only do I have my 2 children, but I feel like I have a 3rd child. And I'll say, our goal really is for our treatment is really for that to change and for it to become a partnership. That is possible. And one thing that is important, like I think, Nan, you were saying that it's important for us to realize we all have our challenges and our differences. Regardless if there's a diagnosis of depression or anxiety or ADHD, we just come to relationships with differences and really getting curious about that. But what can really help is having some empathy and understanding that if someone does forget something that you told them, or you do have to remind them about something that was discussed before, that the partner realizes, okay, this could be related to ADHD. It's not personal, and to have an understanding of that, as well as this is still something we need to work on, and that both people realize how to take responsibility and address it rather than just saying, well, this is just my ADHD. So it's really both parts. It's number one, the other person realizing and understanding this person may be working on it, and that this may be a challenge, and likely could be a challenge from the ADHD symptoms or the other ones that are not in the core of the diagnosis, and say, how can we improve this? But most importantly, to not take it personally.
You want to say something, honey?
Yes, to everything you've just said, and my own personal experiences. The meds were the bottom in the bucket. Without the
Oh,
meds, I could have done all of the therapy and all of the structure and all of the good intentions, which I
yes,
did. But the meds were really the thing that allowed me to build build in the structure and the communication and the skills that were necessary once the bleeding had been stopped.
yes. And did you get the skills from working on it on your own, or did someone help you? With the thing? Uh-huh.
So,
Great
A great book.
book.
Yes.
Yeah,
yeah.
I have dog-eared some of the pages. So you got to do the work.
Yeah.
Yeah.
And I think for some people, I think the having the ADHD with all of the affective instability, that sometimes treating the mood issues and stabilizing that alone, I think I've observed in John, has made a big difference in his other symptoms.
Absolutely. And
So,
again, that's more the rule than not. That if there is ADHD there often is something else.
yeah. In fact, we have a question from one of our viewers, Dr. Teresa Wood, who's a physician. She's asking, can you please say what could happen if ADHD is treated before bipolar is recognized or diagnosed? So if
Oh,
you,
wow. So
yeah,
that's really important. So often, uh, so ADHD is much more common in bipolar, much more common. And so you need to, I would say to almost assume, or if someone comes in with depression, to almost assume that there could be bipolar there and to really look for it. That in the research, they show that it takes up to 10 years for most people with bipolar to actually get the diagnosis of bipolar. That for years they're struggling, they're on different medications or the wrong medications before they actually get the right diagnosis. And so I would say the potential risk, and this wouldn't be 100%, but the potential risk of treating someone with ADHD with stimulants, as well as the non-stimulants like the Strattera, is a risk of exacerbating the bipolar, or causing, if they have mild bipolar, like it's called hypomania, where they don't have symptoms that have led to hospitalization. Treating it with stimulants could absolutely potentially lead to a hypomanic episode, a manic episode, a psychotic episode, and leading to people, and I've seen this, where they've wanted to get a divorce, or they've ended up in the hospital, or they've made decisions that have affected their career. And it's not just with stimulants, it can also be with antidepressants. Antidepressants can absolutely flip someone where it looks like they have depression into a manic episode. So it's really important to screen and to assess, in all the patients, whether there's a possibility of bipolar. And just like with other medical disorders and neurological disorders, there's going to be times where we're going to miss it.
Yeah.
But it's really important to pick up on it. And a lot of people who have bipolar disorder and ADHD, they'll get treated for the bipolar, but they often won't get treated for the ADHD because of concern of exacerbating it. And so it is important to fully and thoroughly treat the bipolar, and then I'd recommend with the psychiatrist then cautiously address the ADHD, but to not ignore it.
Right.
So that someone can be treated for both.
Another question from one of our viewers: what was the book? They wanted to know about that. I think the book John showed, but also it would be great if you could share some resources of books. I know you have some things on your website too, so we'll share
Yes.
your website address when we put this up onto YouTube. So this particular book was called Mastering Your Adult ADHD, a Cognitive Behavioral Treatment Program, by authors Stephen A. Safran, Susan Spritch, Carol Perlman, Michael Otto. I'll put this resource into
They
the
are fantastic.
resources.
They were all colleagues during my training.
Ah.
Wow.
And they really specialized in cognitive behavioral therapy. And I learned a lot from them in terms of treating ADHD using cognitive therapy.
I want to share something vulnerable,
Yeah,
if that's okay.
yeah, of
I
course.
look back on our relationship with him and I think about how I didn't understand.
Yeah.
Because this is a brilliant, high functioning guy who would go to court as a lawyer and pull a rabbit out of his hat, but I couldn't understand for the life of me why he was like, having these symptoms. And I don't think I was very compassionate. I think I used to get really like, you're in my mind judgmental. You don't care enough. It's not important to you. Why am I shouldering all of this? It was, I think I look back and I feel really bad about not understanding. And he also has superpowers. We need to talk about other people have, as you said, the unique strengths too. But it was just, I think, and then think about the impact on somebody like, who's going through life where it's a lot harder for them to just keep things in order, and how that and the consequences of how that affects their self-esteem when they're having when the balls get dropped. It's like, it's heartbreaking. I wish I really had more understanding. I wish we knew this earlier on in the relationship. It would have saved us a lot of, I
It's
think.
all part of the learning.
Thank you,
And
Lemore.
you're so right. I see people where it affected previous relationships that had so much potential, and then in the current relationships, or maybe they're out of a relationship and wanting to get into another relationship, and once they really start addressing what's going on, it can help so much. But like you said, Nan, when someone's high functioning and he can pull a rabbit out of the hat in court. And again, these are some of the superpowers with ADHD. And I mean, everyone's different, and there's so many challenges. But it can be very hard to notice it or to see it.
And Dr. Teresa said, thank you so much, Dr. Shapiro. We had an ADHD diagnosis and psychosis become clear. It took 10 years to figure out it was bipolar, and finally things are okay. 10 years, they
Wow.
said.
Wow. Way to hang in there. I mean, it can be really challenging, but so rewarding.
Playing the long game.
That's right.
And like Lemore says, it's so learning. And if you think about relationship as a conscious coupling, like you're there to roll up your sleeves and
Exactly.
work on your defenses, because the defenses are what create all the problems in relationship, because people get really shut down. Either they dissociate, they go like they avoid, or they pounce. I was like, and me being a little on the OCD side, and him being ADHD, we are very different.
But this
And now
is what's so beautiful. right?
Sometimes.
Because no, because it's I find that in relationships when you have people that are so different, which is also the case in my relationship,
Mhm.
I always say we need to learn from each other, right?
Absolutely.
So we have to take and a relationship is about uplifting each other. It gets so frustrating when we focus on the lacks and but if we really, I mean, there's a reason why we ended up together, right? Because a life is more interesting that way.
And
And
Imago is great like that because we attract partners. We get attracted to partners who are very similar in some ways and very different.
yeah,
And based on like our experiences in childhood, we have this sort of unconscious template. But like I always like to say, relationship breakdowns, and I got a lot of people who come to me in breakdown, means in a way the relationship is working to call attention to
absolutely,
how you need to grow as a person, how
absolutely.
you need to learn how to, regulate yourself, develop parts of yourself. And the breakthrough doesn't necessarily mean people stay together. It could be learning love as opposed to lasting love. But if you do the
Oh, I
work, you can,
love that.
yeah, it's
You learn
learning
a
love.
you learn a lot.
Yeah,
Oh, yeah.
And John,
yeah.
And sometimes,
I'm so glad, man. I'm so glad you brought your husband today. I mean, this is just so wonderful because I think it helps normalize it for people
Yes.
and see how long and beautiful the two of you have been together. John, I'd love you to be more in the frame so we could see because I just
Oh,
think, I
hi.
mean, it's just wonderful having you
Oh,
both here.
goodness.
hold on, let me grab the dog.
Oh, we have,
Now
hey, John.
we're here.
Yeah.
Oh, and now you're complete. It's a vital
One
part
other
of the
thought
relationship.
about this situation here. As a man, and I'm speaking to the men out there. It's difficult sometimes to get over the John Wayne approach to challenges like this. I should be able to solve this. I should be able to work through this. Pills don't solve problems. All of that bullshit that you have to sometimes overcome inside before you're willing to say, gee, maybe I should go see someone. Maybe I should talk to a professional. Maybe the word psychiatrist is something that I need to examine.
You're
You
up.
know,
Thank you for bringing that up. It can be scary.
it
It can be
is.
scary if it wasn't discussed, growing up or amongst your friend group. So to take that step, but often
Yeah.
in
Stigma
a
and
This
relationship
shame.
that can help.
stigma and shame.
Stigma
But I
and
would
shame.
reframe it, I would give it another meaning. It's just, learning the tools to bring out your strength and to be able to manage. And I think that luckily through raising more awareness, people are, being more open to this. And actually, even now, if you look at the research done in singles in America, like people are actually attracted to people who are in therapy because it means that you're doing the work on yourself
Such a
and that you're
great point.
willing to improve and you have higher self-awareness, which is anyway a key ingredient to functioning relationships.
Very true. Very true.
Nan, you were talking about, some of the I love that word, the superpowers. And
Mm.
sometimes that can be upsetting to people thinking that, well, wait a minute, but what about, I mean, I've got these challenges and you're telling me that these are all superpowers and gifts. Well, the challenges are there, but also some of the things that often go along with it. So you were talking about the importance of playfulness. I mean, that often is there. Creativity, spontaneity, not being OCD, but
Yeah.
saying, how about we go away this weekend, at the last minute? And so it really can help balance within a relationship and just kind of, and for the partner as well as the individual to be appreciative of some of those strengths,
Yeah.
which are just so important, as well as, John, I'm sure this is part of it. And how can you really tease it apart? But but what Nana's saying about how you've performed as a lawyer, how can you tease apart the 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 ways that you're able to pull a rabbit out of a hat, ADHD versus not ADHD versus intelligence and experience. It's all really part and parcel. It's, you can't just kind of pull one out and really be the same person. So
You're right.
I think it's wonderful how Nan has such admiration for what you've accomplished.
It's funny. Now that I look back, I've always been very linear. So I'm like a dog with a bone. I want something completed. I don't think you do a research PhD without being pretty OCD, like that's just digging in like that. And I've seen him, he's much more, I think he's a lateral kind of thinker. He's very creative, he's musical, he's visual in terms of arts. So in a lot of ways, I think we're, just wired differently. And I've had to really learn to take a slow start up to conflict. I think he's really learned how to take influence from me, which is hard for men. Men get taught that they're supposed to know it all or fix it all, or,
Or
that's
be
kind
the
of a lot
rock.
of be the rock.
Yeah.
Yeah. Yeah, so it's really been a humbling experience for me to learn how, by my learning how to be able to very slow start up to conflict. And it sounds something like this. If I'm upset about something, rather than jumping on them, I'll say like, "Oh, honey, there's something that I'd like to talk about that might be a little bit upsetting to you. Do you have the space now?" And then he can say yes or no. And if he doesn't, then we make an appointment together. And then often what we do is we create it in an active listening session, which means he's agreeing to listen to me, just to hear me reflect back what I hear you saying is that correct? Is there more? And then he can validate me. You can validate each other without agreeing with each other. That's one of the most important points. So having that container because if you have two people in distress, you got a hot mess. It's not going to go well.
One of the things we do in connection with what Nan just described is we walk together, which for me creates a feeling of entrainment. Remember entrainment?
Oh, that's so interesting. Sure.
That's my experience of the walk and talk together.
Well, tell us about what's entrained. Tell us
Well, it's where
about entrainment.
remember the
That's
heart
really
cells.
interesting.
The one heart cell gets next to the other heart cell, and they both start beating at the same time, just
Wow.
by their physical proximity. When we're in proximity of each other and breathing in sync and walking in sync, there's something about working from the body up or out that works for me in connection with that communication that Nan just described.
We used to run together.
Yeah, running together
One
is another way of
Walkman
entrainment.
with two headphones.
I love it.
And I
That's
didn't realize, but what we were doing, like nervous systems are open. So that's why, like tuning forks, they can escalate. One person's upset, both people feel it, and then it dials it up. So the co-regulation that can happen when you are moving your bodies, and then often we do the walk and talk, where we'll take a session while we're walking, which actually kind of helps things move through. And most days, we don't session because there's a problem. We session to listen to ourselves more deeply and connect. Because it's like, we're together 50 years. That's ridiculous, right? 50
Congratulations.
years.
It's amazing.
Since we were 17
love
years
it.
old, right? But the idea is that, we're always changing and growing and learning. So the ability to connect and to go through things and hold the space for each other has been something that has not just worked so well for us, but it's something that I think it's so important that we need to have so that we can be present not just to our partners but our kids. We have grandchildren now, 5 of them. We have clients, people we work with, to be able to hold that space to really deeply listen. And we're all too rushed right now. We're texting instead of talking. We're not meeting in the real world. We're not getting all of those cues that you get through your eyes when and your bodies aren't co-regulating. So, and you see people, we went out to a concert last night and there were people sitting there just on their phones before the shows, nobody talking to each other.
Yeah, I see that a lot.
So important. to be there together, connect.
That's where the fun is, and the satisfaction
Yes.
comes from that. Yeah.
Nan, I don't know if this would be helpful, but I always feel that, during these discussions, that what people really take away are some strategies. And,
Yes.
and Maureen, you were talking about, well, what can I give to my patients? And I think there's some real effective strategies that people can use that are watching this, or that we can teach people, that we're trying to help, or that we could share, with our partners or with our spouses.
I think the first thing is to regulate our nervous systems, to learn to drop into the breath. And there's the very simplest version of this, which I teach, everybody, is the long, smooth inhale followed by the longer, smooth exhalation. When you extend the exhalation, you kick in the vagal brake. You tell your body gets the note, you're safe. And that when you start to train yourself every time that you're noticing tension in your body or, in your mind, if you make that the cue to drop into your breath, the nervous system up, really the body up is the most important, I think, difference that we can make to get out of the flight, fight, freeze into
Ground
the
yourself.
restorative. People
You're so
aren't
right.
breathing properly. They're on their computers. There's apnea going on when people are not really focusing on their bodies. To remember you have a
Yeah.
body and it's breathing is a good
And
thing.
for sex,
So I'd
it
say that's
affects
the
your.
most important. What's that,
I
Maureen?
was gonna say for sex, your shallow breathing also affects your pelvic floor. Like you need to be taking these bigger diaphragmatic breaths. You're holding tension in that like sling of muscle down there. It creates other physical problems. So for your sex life too, take some deep breaths.
Nan,
So
that was brilliant what you said
Yeah.
about the bottom up, that
Mhm.
not to try to think your way out of it, but what you and John were doing, the co-regulating, the movement, and then also the breathing, with the longer exhale, that even though it may not feel like what you need at the moment,
yeah.
with enough practice, it affects the brain.
And you can then at that point tell yourself you're safe in this moment. Because if you're just sitting there and breathing, this is what all trauma experts are teaching.
Yeah.
Now, in this moment, you can train your body to feel safe. And I think a lot of relational distress is underneath anger is not feeling safe. It's a lot of it is about fear. Deep breath. So if you can give yourself permission to be exactly as you are in the moment, and not to make it a federal case if things aren't going so well with a partner. Don't label them. Don't think that they're, jerks or assholes or whatever. So, oh well, this didn't go so well. So I use a workbook, and I'm going to share that also in the resources that we put out when we migrate this to YouTube it's for couples, that's based on research, effective tools for relationships. And a lot of it is,
Wonderful.
not making it a federal case, learning to be a little less judgmental, a little bit more curious, getting the understandable part, and actually like really giving yourself, I think for me, the thing, full permission to be as you are, full permission for the moment to be as it is. That's not the workbook, that's me. And practice that kind of radical acceptance that allows you to be where you are in the moment. And then you can be a little bit curious, a little bit caring, a little bit playful, maybe have some lust for life, lust for each other. Moving out of the pain body mind, where a lot of us live. I know this. I had childhood trauma that was pretty significant. And I've just really unpacked it in my 60s. And I was kind of trained to be in that pain body, always like hyper vigilant, not okay. And we can start to move into the pleasure mind body, which is actually good for us. It's good for us. It's good for our relationships. It's good for our intimate lives. It's good for everybody. And we need that now more than ever with what's going on out there. We can't get hijacked into fear, and we just got to continue our lives and be grounded and connected with ourselves and each other. The quality of our personal lives makes us much better citizens and and being effective in the world.
Yeah.
You're here.
Well said.
Deep breath. So how do people reach you, Scott, if they want to do a little consult?
Sure. So my website is scottshapiromd.com. You can email me at scott@scottshapiromd.com. And it'd be a pleasure to hear from people, whether they want to consult or they have questions.
Yeah.
There's also a lot of resources on the website in terms of
Yes,
strategies,
there are.
articles, in terms of relationships, time management, organization, how to find a new job. So how to help, balance household responsibilities with your partner. So a lot of things that I think people can find helpful. I love sharing information. I love teaching. So it's a lot of fun.
Deep breath and lots of
Thank you
appreciation
so
for
much,
you,
Dr.
Scott,
Shapiro.
Well, it's great meeting all of you.
and appreciation for Maureen and Limor, who are
Absolutely.
my
And
partners in
John, it's
crime here.
wonderful having you on the
Thank
stage.
you, John, our
Yeah.
special guest.
Yes.
Thank you
Yes.
both
That
for joining us.
surprise, man. Thank you for doing
So
that.
I hope everybody in going into this weekend thinks about what makes a difference, which is being calm, feeling safe, calm, and secure. That's very, very important to quiet those defensive systems in the core emotions, to take some deep breaths, to be present with each other and go for the pleasure, because pleasure is not a luxury. It's a necessity for a well-functioning emotional brain and for a relationship.
Mm-hmm.
You got it.
And
You got it.
So we also have another comment. Amazing to see other dedicated physicians, from Dr. Teresa Wood. And Dr.
Thank you.
Teresa, I'm going to be at Ishwish this year with Maureen. I don't know if you're going, but that's a really good
we will
conference.
both be there. Yep.
Yeah. Thank you so much. Have
Thank
a
you, everyone.
fabulous weekend.
Thank
I
all
think
of
we
you.
covered, yes. Okay. And also she said, and PhDs. So not just
Absolutely.
MDs, but PhDs.
All right. Wonderful.
Thank you so much. Have a fabulous time, Scott. It was such a pleasure to
A real
actually
pleasure.
have you here.
All right.
Big hugs,
Bye.
everybody. Peace out and over, as
Happy
the kids say.
weekend.
Bye.
Happy
Happy
weekend.
weekend,
See
Love you
everyone.
guys.
everybody later. Thank you.
Bye.
Bye.